think that some of the things, I did hear Ben Siegel's talk, who was the Kenneth P. Johnson speaker, which I was a few years ago. And it was a very good talk. And I think his point about aging and how that can affect the microglia and astrocytes during aging is extremely important. And I would recommend that people listen to that talk. There are also some nice talks coming up about oligodendrocytes. The Branzig Prize winner is going to talk about and that as well. So, and then of course the session that I'm in is extremely important, where it talks about precision medicine and looking at the different phases of MS and the different time periods in MS and how that can influence the disease, because it's not a one size fits all. The MS changes during the course of its disease. It's different between women and men. And even, it differs with disabilities. Some people have walking disabilities. Some people have cognitive disability. Some people have visual disability. So I think, moving towards this precision medicine way of looking at things, not lumping everything together, you can find answers if you do things in a very optimal way for each disability, or for females or males, or at a certain age. You can find answers, but you can't find answers if you lump them all together and you don't appreciate those differences between these phases, between patients, within patients over time, and different regions of the brain. So the idea would be to some of these talks will help us, because they look very specifically at one phase or time point different than another. And the idea would be to find solutions and be very specific and surgical, and then use what you've learned in that approach to then find answers to other phases and other times. You know what I mean? The details will differ, but the approach will be the same. The approach should be a very specific approach. So what we're using is cell-specific, region-specific transcriptomics, gene expression of the brain. Many people are doing some of this, and I think even overlaying age onto that and sex onto that. And we will get answers, and they will be precision in nature.